Sickle cell anemia, SCA, is a genetic blood disorder that affects the structure and function of hemoglobin, a protein found in red blood cells that carries oxygen throughout the body. In SCA, the genetic mutation affects the beta-globin subunit of hemoglobin, causing it to form abnormal hemoglobin called hemoglobin S. This abnormal hemoglobin can distort the shape of red blood cells, leading to their characteristic sickle or crescent shape. Causes: SCA is caused by a genetic mutation that affects the production of hemoglobin, the protein in red blood cells that carries oxygen. This mutation leads to the production of abnormal hemoglobin called hemoglobin S. Predisposing factors: SCA is most common in individuals of African descent, although it also occurs in people of Hispanic, Middle Eastern, and Mediterranean ancestry. The risk of developing the disease is increased if both parents carry the gene for sickle cell trait. The different types of SCA include HBSS. HBSS is the most common and severe form of SCA, caused by 2 copies of the sickle cell gene, HBS. People with HBSS produce only abnormal hemoglobin, which can cause severe anemia, vaso-occlusive crises, and other complications. HBSC. HBSC is a milder form of SCA caused by a combination of the sickle cell gene and a different mutation in the beta-globin gene. People with HBSC produce both normal and abnormal hemoglobin and typically experience milder symptoms than those with HBSS. HBS beta thalassemia. HBS beta thalassemia is a form of SCA caused by a combination of the sickle cell gene and a mutation in the beta-globin gene that leads to reduced production of normal hemoglobin. People with HBS beta thalassemia produce both normal and abnormal hemoglobin and typically experience milder symptoms than those with HBSS, HBSD, HBSE, and HBSO. These are rare forms of SCA caused by different genetic mutations that affect the structure and function of hemoglobin. People with these forms of SCA typically experience milder symptoms than those with HBSS. Sickle cell trait. Sickle cell trait, SCT, is a genetic condition in which a person carries 1 copy of the sickle cell gene and 1 copy of the normal hemoglobin gene. People with SCT typically do not experience symptoms of SCA, but may be at risk for certain complications under certain circumstances, such as high altitudes or extreme physical exertion. The pathophysiology of SCA is complex and involves multiple physiological processes that interact to produce the clinical manifestations of the disease. These processes include abnormal hemoglobin polymerization. Hemoglobin S is less soluble than normal hemoglobin, which can cause it to form long, rigid polymers within red blood cells. These polymers can cause the red blood cells to become stiff and misshapen, leading to their characteristic sickle shape. Reduced deformability and increased adhesion. The sickled red blood cells are less flexible and more likely to stick to the walls of blood vessels, leading to reduced blood flow and tissue oxygenation. This can cause tissue damage, inflammation, and further sickling. Vaso-occlusion. The sickled red blood cells can also clump together and block small blood vessels, leading to vaso-occlusive crises. These crises can cause severe pain, tissue damage, and organ dysfunction, and can be triggered by a variety of factors, including infection, dehydration, stress, and cold temperatures. Signs and symptoms. The signs and symptoms of SCA can vary widely, but may include fatigue, weakness, jaundice, swelling of the hands and feet, and delayed growth and development. Sickle cell crises can cause severe pain in the chest, back, limbs, and abdomen, as well as fever, headache, and shortness of breath. Medical management. The management of SCA involves a multidisciplinary approach that includes regular monitoring of blood counts, pain management, and the prevention and treatment of complications. Medications used to treat SCA include hydroxyurea, a medication that helps to increase the production of fetal hemoglobin, a type of hemoglobin that is less likely to sickle. It can reduce the frequency and severity of sickle cell crises. Pain medication. A range of medications may be used to manage the pain associated with sickle cell crises, including opioids, nonsteroidal anti-inflammatory drugs, NSAIDs, and acetaminophen. Antibiotics. Antibiotics may be used to prevent and treat infections, which can trigger sickle cell crises. Nursing care. Nursing care for individuals with SCA includes monitoring for signs of complications, providing pain management and emotional support, promoting hydration and good nutrition, and educating patients and families about the disease and its management. Complications of SCA can include stroke, pulmonary hypertension, kidney disease, eye problems, and bone and joint damage. These complications can be managed through regular monitoring, medical treatment, and lifestyle modifications.